On this edition of On the Ground, I'm talking to Vincent Schaffler in Sweden. Vincent is a business owner on the ground in Sweden. He's an expat Canadian, been in Sweden for 22 years. I wanted to get his insights on what's happening in Sweden right now, considering that the Swedish authorities have decided not to implement a strict lockdown in their country. Business is pretty much going on as usual. The effect of that so far has been is that their rate of transmission, their infection rate, and their death rate is considerably higher than their neighboring countries. So there's a lot of criticism and scrutiny on that decision. Their defense is that flattening the curve only pushes the cases and the rates farther down the line, and that they're well prepared to deal. Their healthcare system is well prepared to deal with it now, and they prefer to take it on head on, which is what they're doing. So we'll get Vince's insights on what's actually happening on the ground there. Thanks for tuning in. I've got my good friend Vincent on the phone, on the line here, and I'm gonna interview him and talk to him about what's happening in Sweden. Vince moved out to Sweden. How long has it been now, Vince? 20 years?
Yeah, 1998 we moved out, so it's 22 years.
Wow,
yeah,
it's been that long. So Vince moved out to Sweden 22 years ago. He's running a business out there. So I wanted to talk to Vince and get an idea of what's happening on the ground in Sweden. We're hearing all kinds of things about Sweden's approach to the pandemic, good or bad. So just in the interest of actually getting somebody's viewpoint from the ground in Sweden would be interesting, I thought. So Vince, tell me a little bit, or tell everybody a little bit about yourself, what's going on, what's been happening in the last 22 years.
Lots. I moved out in 1998 with my wife after meeting her when I was an exchange student here. Finished my education back in Canada and then moved out here. We had a little daughter that was 7 months old, who is 22 now, turning 23. I had one more son who's 18. I love Sweden. It reminds me of Canada in a lot of ways. I think Canadians are a little bit more competitive than Swedes, so it's kind of easy to to run a business and do well here. I think different laws, different customs, different mindset, so it's got its pluses and minuses. But for the most part, it's a lot of fun. I'm having the time of my life. Today I have a motorhome dealership. I had a motorcycle dealership for 17 years that I sold a few years back, and I got a couple of other things going as well, a little bit of some commercial real estate, and I also invented a product called Smellwell, but we can take that another time. Have you heard about it? Did I tell you?
Yeah, I saw some stuff on social media, but I don't really quite know what it's about. I mean, you and I actually met in sales, right? We were working at Future Shop.
Yeah.
Hawking cell phones to people, free cell phones for people when that was a big deal, right? And that's how we kind of met at Future Shop. And then I remember when I was living in Toronto, then you started moving used minivans, right, from Canada to Sweden, because you're saying minivans are in high demand in Sweden and you can't get them, and you were doing that. So you kind of turned that into a business. That's awesome. Yeah, tell me a little bit more about the dealership and tell me a little bit about Smellwell.
Yeah. We're 25 employees now. We turn over about 200 million Swedish crowns. What is that? Divided by 7, maybe 27, 28 million maybe a year. Sell a little over 400 pieces a year. It's quite interesting. We're only dealing in commission sales. We started selling new vehicles as well, but I wanted to kind of polarize to one thing, so I just stuck to the used segment and trying to optimize that and fine tune it so it's a real production machine, and it's been going really well. Been a little bit scared now with the situation, the Corona situation, how it was going to affect our business. But what's actually been happening here in Sweden is that our neighbors in Denmark had closed their borders, in Norway and Finland. So all of our borders basically were closed. Sweden never did close their borders, but no one was able to get in and out anyway, really. And the government here is recommending that people don't even consider traveling outside of the country through the summer. And Sweden they really treasure their summer. There's an industrial vacation that's about 6 weeks long. It's almost religious. In Sweden, you are, as an employer, I have to offer my employees 4 weeks. They get 5 total in a year, but I have to offer them at least 4 weeks of holidays together during the summer. That's Swedish law. That's tough. I can tell you, when your high season is in the summer, to have 25 people wanting to get 4 weeks together, it's a little bit of a puzzle, but it works anyway. In any case, Swedes are huge travelers as well. To go down to the Canary Islands or to Italy or anywhere, Swedes are huge travelers, and this is really taking its toll on the psyche of the Swedes. So they're trying to figure out, how do I solve our holiday vacation this summer in 2020? And of course, a motorhome and caravans is the perfect way to do it. You can travel within Sweden. You have your own vehicle with you, your own bed, your own toilet, your own kitchen, and you have social isolation. Sweden's a beautiful country, so our business is actually it's booming, and I expect to have a really, really fantastic year. And I think it's going to continue for a few years as well, because the travel industry, the hotel industry, has changed now so much that it's going to take a long time to get back to any kind of normality. And so that's kind of where we're at with that business.
So let's lay the foundation here. So Sweden has about 22,000 cases, is that right? Yeah, 22,000 cases, 2,700 deaths, population of 10 million. So that gives it about 22 per 100,000 in terms of deaths. Now, in comparison to Denmark, Norway, and Finland, Denmark, Norway, and Finland, well, 7. I think Denmark has 7 per 100,000. I mean, but Denmark has 6 times the population density of Sweden, right? So that's understandable. Norway and Finland have about 4 of 100,000 deaths. So Sweden is considerably higher. And let's given the fact that Sweden has twice the population as the neighboring countries, so that plays into a little bit. But in terms of per 100,000 deaths, to have 22, 3 times and 5 times the deaths of your neighbors, that's got to be concerning. So, what's the I know that initially some of the criticisms of Sweden was that they were trying to build herd immunity. Your medical officers have denied that and said no, they weren't trying to do that. And I thought this was really interesting. So, from what I can gather, is that the strategy there is that listen, flattening the curve only pushes things further down in time, right? So they said, we're not going to try to flatten the curve because we have the healthcare system, we have the hospital beds, we have the means to take care of people now. So that's what we want to do. So that's why they didn't impose a strict lockdown. Is like, instead of pushing it down the line, they felt that they had the capacity to take care of the sick. So what are your thoughts on that? Is that sort of what the feeling is, that the strategy was on the ground? Because there's no denying that your lockdown was much more lax than the neighboring countries and the European countries.
Yeah, it's true. Denmark locked down quite early, and Finland as well. Sweden never really did the same, and the only reason I think that, at least if you read the newspapers here in Sweden, one of the biggest reasons that we have, they felt if they had a chance to do that over again, they would have imposed some sort of restrictions on that earlier. I think it was the 1st of April, if I'm not mistaken, that they closed access to all the old folks homes, but then it had already been in, and it's the staff actually that had brought it in. And I mean, you need the staff there anyway, but because of lack of safety supplies and masks and gloves, and I mean, everybody had that problem, but I mean, so you still need to have the employees in there, but because of the lack of that and the lack of testing, which everybody has and still has a problem with, many of the people that were going in working were bringing it in with them without any symptoms. So it's an extremely unfortunate situation, but it is that's reality.
Yeah, I mean, I thought that was interesting. 50% of the deaths are, with care homes and the elderly homes, and that's, and that is a good point that, it would be difficult to lock them down because at some point they still need care from staff, and if staffs were the one that were the initial point of transmission. But I guess, yeah, I mean, more precautions could have been taken, and make sure that the distancing and all of that kind of stuff was done. But okay, so let's talk about the rest of it. So do people on the street, are they concerned about, the high rate of transmission, the high rate of deaths? Or is anybody concerned about that? Or people truly or fully trust the government strategy and are just going about life as normal?
I would say I live in a smaller town, I would call it, 60,000 in our little county, and it's not a big town at all. And it's, here it's more or less, you can go out, you can take a coffee in town, you can walk and see people out enjoying the sunshine and the beach and everything like that. So here it's a lot less of an issue, I would say. There's a lot of businesses that are affected, obviously, here, hotels. But we were in Gothenburg yesterday, which is the second biggest city in Sweden. Our daughter lives up there, so we were up there to pay a visit. And we actually stayed in a hotel in the evening. And they're very conscientious of, your 1.5 meter to 2 meter distance between each other. There's hand alcohol all over the place. They have taken away any, the breakfast buffets. They've done what they can do, and they're. I felt entirely safe. I had no problem there. We went out for a coffee to an espresso house, which is like a coffee shop out on the. Today it's beautiful weather, sun is shining. They've distanced the chairs from each other so you can't be close to each other. We went into a furniture store and looked around. Everybody, I was talking to my wife about that, and I think that there's a certain level of sophistication with Swedes, that they have respect for each other in a way like the average people, all of the people. That level of sophistication and respect, mutual respect towards each other, it means that you take this seriously. You don't sit beside someone even if there's a chair beside them. You wash your hands, and that's one of the strategies that the Swedish government is also being very clear about, is having individual responsibility. And I think actually the Swedes both deserve that and have done a good job with that. So in a bigger city, there is concern, absolutely, to answer your question, but there is also people are still living, people are still going out, they're still buying things, but they're in all of the hardware stores everywhere is all about keeping the distance. So you don't see people wearing masks. But you see people washing their hands all the time, hand alcohol all the time, and not sitting beside each other. So,
yeah, I mean, but the people would argue that your neighboring countries, Denmark, Norway, Finland, would have similar cultures, I would think, in terms of respect for each other and respecting the distancing. But they still impose the restrictions and lockdowns, right? They shut down businesses, they shut down schools, they took all the necessary precautions, and and it shows in the numbers, right? I mean, you have 3 times and 5 times the death rate that they do. So what do you say to the people who bring that up, of the fact that the numbers show that Sweden, in terms of its neighbors, far outpacing in terms of cases and deaths?
It's a good point, but the fact is that we're just in the beginning of this, and you're not able to draw any solid conclusions at this point, other than the fact that there's a higher number at the moment. But how is that going to look in a month, or 2 months, or 3 months, or in 6 months? It's impossible to say. There's too many other factors that you have to consider. But You're right. I mean, the Norwegians and Danish people very similar. Finland is quite a long ways away. It's a little bit farther over towards Russia, so you don't have much contact with them. But there's also mental health. I know quite a few people in Denmark, and there's a high level of frustration there about being home, and I mean it's been going on 4, 5, 6 weeks. They're talking a lot in the news as well about domestic violence, problems with gambling, alcoholism, depression, suicide. There's all kinds of other things, businesses as well. I think that it's quite odd as well. You know, Sweden is not a country that normally sticks its neck out. They're a country of average. Don't be too loud. Don't drive the fastest, loudest car. You know, there's something called jantelagen, which means that everybody is kind of in the middle. And so for Sweden to do this is completely out of character. But I think in general we have a tremendous amount of confidence in the Swedish healthcare that they're making the right decision. I think the numbers, I mean, sure there's a higher number of deaths here, but like I said, it is in the beginning of the epidemic, and it's a long road. We need to kind of take a look in some time how mental health is and everything else, because there's other factors here. There's not just one thing to pinpoint. There's a lot of other moving parts here, and I think everything needs to be factored in order to make a fair conclusion, and that's going to come later on down the road.
No, you know what? You're absolutely right on that front. Those are good points that you made. I mean, I think that, you know, the idea that, you know, flattening the curve may only just push the rates further down the line, and that if you have the capacity right now to take care of your people, then you take it on now, which seems to be the Swedish strategy. And I mean, mental health, I mean, they, you know, out here in North America, you know, they talk about that a lot, about that being the real, you know, second and third wave that we're going to have, is that for all the reasons that you cited, is that's what we're going to have to deal with, and we're already dealing with, I mean, increased incidents of domestic violence, and but I mean also, yeah, alcoholism, drug use, all these kinds of things, and then just, you know, pure concerns and frustrations about economics and finances and things like that. I think we're going to have to deal with all those too. So that's also, again, you know, that's actually another valid point of why a country like Sweden might not want to have to push that down the line too, and have to deal with it later, and just let their citizens go about life as normal. That's really interesting. So what do you think, what are I mean, you said your industry is doing fine, but what about some of the other industries? What are the forecasts looking like? What's the overall forecast for the country looking like?
It's disastrous for sure, but probably a lot less disastrous than a lot of other countries that have taken the hard line. You know, obviously everything within, wow, there's so much, you know, entertainment, hotels, the airlines, it's really, really tough. But I actually, the Swedish government has really stepped up. They've come out with, I think, the 7th package now on to help small business owners. Sweden has a good economy, at least had a good economy, and are in a position to be able to be generous with small business owners, and they did that directly from the start and just kept on coming. So I have to say that I'm happy to be in Sweden, to have the freedom I have today, to have responsibility for myself, what I do, how I do it. I think business owners in Sweden are also happy that that we're being looked after as well as we can. I'll just give you an example. A lot of people in manufacturing know that it's called permittering. I don't know what that would be called, in maybe a leave of absence of some kind, or a subsidy. So if you have a full-time employee, they can go down to working 40% of the hour of their full-time work, and they'll get 92.5% of their salary. And that is subsidized by the Swedish government, which is, for me, I've got a couple of people at home now. because if there's any cough, sore throat, fever, anything at all, I want you to stay home, and I want you to stay home for a couple of weeks. And it's okay to do that because we are, we're getting subsidies by the government to be able to do that, which is great. I do have some people working at home as well. So my sales guys are at home, working from home. Sweden is a very IT driven country, so it's not a problem. Internet is fantastic. It's a good country, and kind of it makes you wonder a little bit why the numbers are a little bit higher at the same time. But it could be because of that we haven't locked down as tight as the others. But which is better? What do you think, Najib?
Well, I mean, I think you're absolutely right, Vincent, that, it's too early to tell what the long-term ramifications are going to be for any country. There's, most of the reason why I'm doing this series is because, there's so much speculation in terms of comparing countries, with each other. And we've also seen, the U.S. is a great example of a country that acted too late, and what's happening with their cases and death rate as being the highest in the world. So I think and then the reason why I'm interviewing people in India and Pakistan, countries with giant populations, who are trying to impose lockdowns as well, is because again they have low numbers, but everybody's saying it's because testing is low as well, right? And reporting is low in terms of people dying at home, etc. Right? So I wanted to get all those perspectives, and I think you're right. I mean, I think right now everybody's kind of speculating. This is unknown territory to most people. I don't know. After researching everything that's happening in Sweden, I'm kind of, on the fence, right? Like I understand like this, the whole idea behind flattening the curve is to make sure that, healthcare and hospitals have time in order to react, right? It's not that, the idea of flattening the curve isn't that everything that, is going to go away. It's just pushing it down the line so that, hi, baby. Come here.
I can't pay you now. I'm going to have sour with Mama.
Okay, baby. Okay. Come say hi to my friend Vince.
Hey, sweetie. You must be
Vince.
Nora. Is your name Nora?
Sorry, Dad. I can see you.
Okay, baby. You can't. She said, I can't talk to your friend right now. She's very busy. She's playing with mommy. So. Okay, baby. Have fun. Talk to you later. Where was I? Yeah. So, when I read that, I was like, that kind of makes sense, because the.
I can say hi to your friend.
Okay, baby. Okay, thank you. That's my life, like every day. Kids are right. Like if you're on the phone, you're talking to someone else. They got to get in there, right? So the whole idea was to give a chance for healthcare to catch up and get prepared for whether it's coming now or it's coming later. So to me, it's like if your country says that we are ready for it and we have the capacity right now if the numbers come in and we can deal with it, that kind of makes sense to me. But again, you're not dealing with it if your death rate is that high, right? You're not taking care of the people. Would your death rate be as high if it was pushed further down the line and you did practice the lockdowns and flattening the curve? Would it be as high? But again, like you said, only time can tell whether your neighboring countries catch up in terms of cases and death rates, because all predictions say there'll be a second and a third wave, right?
Yeah, for sure. And I know that Sweden has always they've never been under 20% left in the intensive ward spaces. So they've always been able to manage any.
Okay, sorry.
How's my sound, by the way? Is the sound all right?
Yeah, it's perfect. It's great.
Yep. It's just on a regular laptop, no mic or anything like that. So I've been doing quite a few of these lately. And it works really well. You can't have much noise in the background because it picks it up. But that's also one thing that's going to be interesting to see how video conferencing changes the landscape of business here. I know a lot of salespeople that are on the road, and they're starting to understand how convenient it is not to drive 3 or 4 hours to a customer, do 1 or 2 meetings, and then drive back for the day. I mean, because it's more acceptable to do this, they're able to get in maybe 4 or 5 or 6 meetings during a day instead of 1. It's going to be tough for the hotel branch and conference branch, and it's going to be interesting to see that as well.
Yeah, I think this is helping people adapt to technology and video conferencing and remote working, all these things. Like people maybe who were resistant to it before and felt it wasn't as effective as face-to-face. I think those people are going to adapt to it. And again, there's a lot of speculation about how work is going to change because of the pandemic and us having to work from home. Or I don't know, man. Like I think it could go both ways. I think that on one side of the coin, there will be certain things that people will be like, what, I don't need to go to as many face-to-face meetings and I can do it over video conference. The other thing is too, I think people are also recognizing the importance of the personal touch of the face-to-face. I think, many people that I talk to, including myself, are, missing that aspect of work and networking and interacting with people and talking to them in person. And we also understand the limitations of video conference. I mean, this conversation, if you and I were in the same room and, having a drink and, and talking would be much different, right? The whole feel and tone for both of us would be much different, right? I mean, I had to switch over from doing these shows, in person with people to this. And there's definitely a huge difference for me in terms of how I can interact with my guests and how I can read them and how you play off of each other. It's very different. And I think that, as much as, technology and all the remote work stuff is great and actually will make us efficient and save time. And I think that also people are going to recognize the value of having a workplace and places to go and interact with other people.
Good point. Because I haven't really had to change much of my regular business day. It's we still have customers coming in, a little bit less, a little bit more email and a little bit more phone calls, I would say. Less traffic in the actual shop, because a lot of our customers are the 55, 60, 65 plus. So we're seeing less traffic, but we've also done a lot of things here in order to make sure that we're doing our part. Separating people so everyone has their own office. We have alcohol for the hands all over the place. We don't eat in the same room. There's all kinds of stuff. We're able to welcome our customers before business hours or on a Sunday, if that's what it takes. We can do live video tours of different units that they're interested in. So it all works. And I mean, all you have to do is be able to get onto Facebook and click a button, and you can be one-on-one with the salesperson, and they can go through a unit. So I think the Swedes are pretty good at adapting that way. They're a long way ahead of a lot of other countries up in their golden years, I would say.
So, it seems like the general opinion of citizens is that the government is doing a good job taking care of people. Has there been also stimulus for individuals and households? You mentioned there's been considerable stimulus for business, but what about for individuals and households? Has there been anything along those lines?
The vast majority of assistance that the government has given right now is to the businesses. There is the tax relief that you can put your tax off, but not much at all for individuals, no.
And no concerns around that? People don't feel the pinch of, not having money directly go to them in their pockets to take care of their household expenses?
I would say because of the generosity to the businesses being able to keep people employed, they're still able to manage on 92.5% of their normal salary. That's really generous. So I think maybe that might come a little bit later down the road. Like I said before, there's a 7th package that just came out last week. I'm pretty sure there's going to be an 8th and a 9th as well. And maybe they'll take a look at on a more personal level, a little farther down the road. I know that there are actually people being let go now instead of this permittering, as it's called in Swedish. What's that called in English? You know?
Furloughing, I think they're referring it to, like furloughing. So they're, allowing, kind of temporary layoffs, and then the employers are getting, are able to still keep some people employed, and they're given a stipend or assistance in terms of the wages of keeping people employed. So I don't know, the closest thing that comes to mind that I keep hearing is furloughing, versus laying off people.
Yeah. But because, to answer the question, I think it's so generous that I don't think people are that concerned at the moment, or that there's so much unemployment now that people have actually been laid off, that it's a huge problem yet. That very well could happen as time goes on and companies aren't able to get in any sort of income. If you take a look at the restaurant branch, for example, they're feeling it, but they're also coming up with new ways of making this. A lot of home delivery now, and they're still open. They just don't have the amount of customers as they've had before, obviously. So they're able to cut their costs and keep on the majority of the employees. So it's a generous system, but to answer your question, I think the individual bailouts or the help from the government will come at a later date. It hasn't really shown up yet. Hasn't been needed either.
Has the government talked about, how to get things back to normal? Is there some sort of a relaunch strategy? I know some countries, here in Alberta, we've announced a 3-stage, relaunch strategy of getting things slowly back to normal. I thought was France doing the red and green zones? I thought that was really interesting. The idea that you would, pick the areas that, where the rates are low and there is healthcare capacity, and, and there's the individual cases aren't increasing as much. Pick those areas first to open up, and then, red zones where the rates are quite high, still keep them locked down. I thought that was an interesting approach. That's not an approach I've seen from any other country. Has the Swedish authorities talked about anything like that, or what a staged rollout, or how are things going to be? Because you guys haven't done much lockdown, but as your neighboring countries open back up, you'll have to adjust for that as well, right?
Yeah, no, you're right about that. We haven't really locked down that much yet. So to relaunch something that hasn't really been completely locked down, I think the majority of their efforts are being put on healthcare and making sure that there's enough beds, flattening the curve, like you said, and helping small business owners with their rents, with their taxes, with different credits in order to be able to weather the storm. So, but there isn't a lot of discussions about, getting back to normal because it hasn't moved as far away from normal as many other countries. So that'll also come, I think, down the road.
I thought it was really interesting and funny there. I read something about, because you have a spring festival, I guess, that's really popular that people come out for, and so they were spreading chicken manure in the park so that people wouldn't gather because of the stink. They said, well, it accomplishes 2 goals. One is you get to fertilize the field, and then second, it keeps people away. So obviously they're conscious of, of the fact that you can't allow people to gather in large groups to control the transmission. So there is some steps being taken, but I thought that was an innovative way of getting your fertilization done and also keeping people away.
Yeah, for sure. That it was a Walpurgis, it's called. The Swedes are really they take their holidays pretty seriously. That's one of the big ones. Midsummer is also huge, where Sweden is a kind of a long, small country, and during these high times, everybody basically from the middle of the country, they go out to their summer houses on the coast, and even that they were saying that 90% of the normal traffic had diminished, 90%. So only 10% went out as they normally did, which is it's a huge number. That was over Easter basically. So we're right on the coast out here on the west coast, and there's a lot of summer houses here. Way less summer guests. There's you can go to the hardware store or the grocery stores, and there's a lot less traffic. So the people are listening. There's still people coming out here because their summer houses are, they're pretty nice houses. You can live there if you're retired and you or working at home, for example. You can just as easily work from your summer house if you want to be able to enjoy the sunshine and the beach and the fresh air out here. If you're living in one of the, like a Gothenburg or a Stockholm, these big epicenters are where all this is really happening, you can move down to your summer house here and work just as well from home here as you could without being in the middle of the mess. So it's an interesting the healthcare around here in Varberg, the city I'm from. Our neighbor is an anesthesiologist, and he's a little bit uptight about the amount of people that are here, according to him. But at the same time, there's not that many cases in our county either. He just is a little on edge about it, I would say. And they're expecting that wave to be happening basically from now forward. Now, when we're getting into the early summer.
Yeah, it is good to hear from you that people are respecting the social isolation and distancing despite not having to a forced lockdown. I mean, that's really good to hear. And it remains to be seen of whether your numbers are just high early on because you didn't do a strict lockdown and then they smooth out later, whereas your neighboring countries might catch up in that regard. So let's see what happens. I mean, I think everybody's keeping their eye on Sweden to see how this all plays out. But yeah, so maybe I'll check in with you a little bit later, maybe, a month or two down the line. We should check in again and see what's happening, and you can give me another lay of the land then. Thanks so much, Vince, for agreeing to come on the show with me. And I think that you shared quite a bit of valuable insight that people will find interesting. Anything else you wanna share before we close off?
How is it going in Canada? I've been here so long that Canada seems a long way away, longer than ever. How is it in Canada these days?
I think relatively speaking, we're doing really well. I mean, in Alberta, especially where I am, and where you're from, we're hammering that curve like nobody's business, right? And our cases and rate is very low. There is some concerns, between Ontario and Quebec. Quebec has quite a high transmission rate and quite a high number of cases versus Ontario, which has a considerable higher population. So there's some concern there, but slowly most of the provinces have rolled out a relaunch strategy and getting back to business over the next couple of weeks. It seems like most of them mid-May slowly start opening things up, and within the next month or 6 weeks, towards I think end of June, kind of be back to business. But again, it's a phase out strategy. There's no dates except for stage 1 right now, which in Alberta is like May 14th, where considerable services open up again. But then the stage 2 hasn't been announced because it all depends on what happens after stage 1. If the rates start going up again, then maybe it's a clamp down again. So it's a very cautious approach. Cautiously, the provinces are starting to loosen up the restrictions. Obviously, the economic toll is huge. They're saying something like could be 20-30% unemployment. I think we're already at 15% in Alberta, 15% unemployment. The projections for small business are just disastrous. 50% of businesses saying they may never open up again, depending how long this goes on. Many businesses have already shuttered up for good. So the economic realities are devastating. But I think mostly people are just kind of taking one day at a time, 1 week at a time, and seeing what happens. There has been quite a bit of stimulus federally, helping out individuals. There's sort of a basic income, $2,000 a month for individuals who are eligible, who can't work. and then lots of other programs for businesses, for nonprofits, for indigenous communities. So the federal government, I think overall, people are highly approve of everything that they've done so far. Obviously, as I keep saying to people, like, this is something that takes time for things to roll out. I mean, obviously people want things faster and they want the bailouts and the assistance and all the packages faster, but these things take time, and also they take money, right? And there's only so long you can go providing money to citizens when you also aren't getting money in. There's no revenue coming in as well, right? I think we're $200 billion in the hole now federally, so that has to be recovered somehow. The economic toll is quite concerning, and will be for a long time. But as far as the health of citizens, I think everybody's doing a really good job of that across the country, taking care of people and respecting the restrictions and the lockdowns. But again, yeah, people are getting antsy, and there is those mental health concerns, as you said, and provincially and municipally, different provinces have different ideas of how to approach that, of taking care of the citizens, and some are doing better than others, some are being more criticized than others. But overall, I think in Alberta and in Canada, it's being handled quite well. I think people overall are very satisfied with the response from government.
How hard is the lockdown?
It's pretty good, severe. We immediately towards the end of March, daycare, schools, businesses, were all shut down. And we also shut down parks and, even dog parks. Dogs have to be on leashes. It hasn't gone so far as, people being told not to leave the house. You can leave the house, but obviously, maintain social distancing restrictions and requirements. Grocery stores are open. There's essential services, groceries, gas, that kind of stuff that's still open in terms of retail. But hotels, restaurants, all of that kind of stuff was shut down totally. I mean, you can obviously get delivery, but no sitting in cafes or restaurants, that's for sure. So basically a total clampdown. Just this weekend they opened up some of the restrictions on parks and letting people go to parks and things like that. But even playgrounds were shut down for children as well. And golf courses and these kinds of things are slowly being opened up so people can do summer activities. But May 14th is actually the stage one lifting of restrictions, where some of the retail services, hairdressers, barbers, and restaurants and things like that can start opening up with limited capacity, obviously. So yeah, it looks like what they're trying to do is maybe by the height of summer, July, all things being equal and not having another surge of cases, kind of lifting all the restrictions. That looks like to be what the rollout will be. But it's definitely a staged, very cautious relaunch.
Wow, that is extreme. I just think about something like golf, for example. And how are people thinking there? I mean, are they, because I play golf here, and I mean, you're out by yourself, you're walking around in the fresh air, you're feeling good, except when you miss the ball or have a hook or whatever. A slice is the only frustrating part about it. But I mean, how are people linking that together with a high risk area? I don't understand that. It doesn't make any sense.
Well, see, I think the issue, though, Vince, is, and this is, a very hot, sensitive topic here, right, is that it's not our ability to golf. It's the people who have to work so that we can golf. You understand what I'm saying? So if the worker who's required to, mow the green and, take care of the facilities at the golf course has to come to work, has to maybe take public transportation, has to deal with childcare so that we can golf, right? Where's the equality in that, right? We're putting other people's lives and health at risk so that we can enjoy something that is, basically trivial. It's not a need to do, right? So I think across the line, that is where people are a bit concerned, is that yes, you can open up restaurants and have, seats spread apart and do 15% capacity and, and slowly like raise it from there. But somebody's got to work those places, Vince. Somebody's got to work in the kitchen, right? Somebody's got to make your food. And maybe those people, don't have the luxuries that we have of getting into cars and going there or walking there, and they have to take public transportation and, and childcare. And if the daycares aren't open, then what happens there, right? So, we sometimes look at things only from the viewpoint of, as consumers, why can't I get a haircut? Why can't I go to eat? Why can't I golf? Not realizing that that's all on the backs of people who have to work to make that happen for us, and they don't have the same luxuries as we do.
That's interesting. Now I really see the difference in how this is spun in the different countries, because people want to be able to go to work here. They do go to work, and it's not like you're throwing them in a pool of a virus here. That's the mentality here, at least. There's people working on the buses. They're keeping distance. They have like Apple Pay and contactless or no contact payment for so many different things. Like they're not as concerned about being on a bus with somebody else, obviously, as you just explained. Interesting. That's definitely a big difference.
Well, it is a big difference, right? I mean, a lot of the reasons why, we here in North America admire, the Nordic countries and European countries is, a number of things that you've touched on. One is, the vacation time, right? I mean, in where you are, people aren't just living to work like we sort of do in North America, right? Like you're lucky if after 20 years of working, you get 4 weeks of vacation, and zero chance you're going to get take all those 4 weeks together, much less being mandated by government. And how the rat race is here, right? So are people in a hurry to return to that rat race, Vince? They're not, right? Especially given the fact that now they have concerns about childcare and health and safety issues, right? So I think that's a big part of it. I mean, Canada, as much as we tout our social systems here, right? We're not a true social democracy in Canada, right? We don't tend to our citizens the way that some of the countries in Europe do, right? So I think that confidence that you may have in Sweden, that your government's doing what's in the best interest for you, not everybody has that confidence here in Canada, and especially not in the US. Right, so we do have large vulnerable populations. I don't know what that situation is in Sweden, but we have, as massive vulnerable populations here, indigenous, homeless, etc., that are, much more affected by this lockdown and the health concerns than the everyday citizen.
Yeah, we have a lot less of that here. Very little homeless people or people living in poverty. Very little here. Everything is, like I said, it's very in the middle. And the people that are go-getters that are making a little bit more money, but are happy to pay in the taxes to be able to help out the people on the lower end of the scale. That's in fact, me coming from Canada, this is a bit interesting. I don't mind paying taxes, believe it or not. It sounds strange, but you get a lot for it. You get a lot for your tax money here, and I've learned. I didn't like it in the beginning, but I'm okay with it now. In fact, right now, me being able to run my business, have 24, 25 people that are fully employed, paying in my taxes every single month as like a good citizen, I'm quite happy about that. We made a little film that I put out about, hey, if you're wondering how you're going to spend your holiday this summer, take a look at a motorhome. It's a really great solution. And I put it out on Facebook, which is a good place to reach our customers. And there was one nurse, actually, that commented on there about me trying to make money on Corona, and I answered her back through Messenger, not on the public. I took it away because I think it was inappropriate to do that on the social media. But I sent her a message and I said to her, I said, you know what, I've got 25 people working for me. They've got full-time employment. I'm not taking them down or using the government's generosity in order to reduce my the amount of taxes I have to pay or anything else. I'm a good citizen. I'm a good employer. I'm paying my taxes. I'm proud of it. And I think that should be worth something. You should not be casting dirt on me because I'm that person. You know, it's that's a little bit of this thing I was telling you about, this jantelagen. When I told you about that, where you shouldn't stick your neck out. You know, otherwise people. I don't believe in that. I'm still Canadian. I'm a proud Canadian, and I don't mind sticking my neck out. I don't mind being in the front of the pack at all. I'm comfortable there, and I stand absolutely for the different decisions I make, as putting out a message saying, hey, listen, if you're wondering what you're going to do for holidays, come on by and take a look at a motorhome because it's a good solution. I stick by that. I stand by it, and she actually never responded to the letter I wrote to her. But yeah, it's a little bit of an example of how some people will try to spin it for you. It's a little bit frustrating.
You know, and you know, we're getting into a bit of a socioeconomic conversation, which I think let's do that, right? Because I think that's a interesting comparison to make between Canada and Sweden, and you're in a unique position to do that, having lived, you know, more than half your life here as well. So you can have a perspective on both sides and give me that perspective as well. So here's the thing, Vince, like that, you know, we all have to recognize is the reason why countries, a big reason of why countries in Scandinavia, Nordic countries, European countries can take care of citizens the way they do is that you have generally very homogenous populations, right? Like what percentage of Swedes, people living in Sweden are white, for example? Probably what, 97%, 98%? What's the percentage?
It's high. It's very high, and they're 100% Swedish. Mom is Swedish, dad is Swedish, so it's
yeah. Exactly. So, you know, some of the research suggests that, you know, why, you know, those countries can practice, you know, socialism basically is because, you know, because of that, right? Is because there's this feeling of like, we're all just taking care of each other. You know, everybody's of the same people, right? You know, those racial concerns and overtones don't happen in those countries because most of the population is homogenous, right? And that isn't the concern in places like Canada. So that definitely plays a part. You know, in Canada, you know, now it's being questioned of why we aren't even tracking racial and ethnic data in terms of coronavirus, right? To understand who the truly vulnerable populations are, right? In the US, you know, it's being shown that Latinos and Blacks have a 50% or 50% more likely to contract and die from the virus, right? And we're not even tracking that in Canada. So how can you, without tracking that, how can you deploy resources properly? How do you know that you're serving the right communities? How can you prepare for future pandemics when you don't even realize, or you're not even tracking, like which communities are the most vulnerable along, you know, ethnic, along racial, along socioeconomic lines, right? It's sort of like you're painting everybody with the same brush. You know, even our approach to the assistance, right, is everybody gets the same amount of money regardless of their income or their social or economic status, which is ridiculous, right? I mean, it's great for everybody, but it's ridiculous, right? So, you know, there's other people who need more help. You know, there's people who, you know, $2,000 a month doesn't even cover their rent, right? And for middle class, you know, you're making up the difference in, you know, working part-time because you're able to work from home, and your white collar job allows you to keep an income going, you know, or you're a double income household. But that's not the same for people living at or below the poverty line, right? $2,000 a month, you know, doesn't even cover rent and basic necessities, right? So there's that toll as well, right? So there's a lot of things that play in a country like Canada. You know, our geography, right? Look, you know how vast Canada is, and you know how far flung and spread that we are, and you know 80 or 90% of the population all lives along close to the U.S. border. So we have that U.S. Politics and culture seeping into our culture as well, which we have to deal with in the age of Trump, right? So a lot of the things that people believe to be happening aren't really happening in Canada, but because they're happening in the U.S., we feel like it's happening here as well. But also too, I mean, it's getting proven more and more that it is happening here. It is seeping into here, U.S. style politics, U.S. style taking care of big, large corporations before taking care of small business employers, right? I mean, you guys are on your 7th package for small businesses, right? We still haven't gotten our first. I think we're just starting to roll out the first assistance for small business, who by far are the biggest employers across the country, right? The approach that Sweden's taken of, take care of the employers will take care of the workers, is definitely not what's happening here. So all of these things create a much more volatile, sensitive, environment that has to be carefully managed.
Interesting. I actually haven't spent that much time over the years. I mean, once in a while you hear some rules or some laws here that just shock you as an employer. But I've never really compared in depth the differences between my experiences and my life in Canada up until I was about 28, I think 27, 28. And then from here, it's almost been half of my life I've been living here. Still consider Canada home in many cases, but it's definitely got its advantages. I'm happy to be living here, I have to say.
What's the minimum wage in Sweden?
I would say it's a little bit over. It's a little over 80 crowns an hour. So what could that be? About $11, maybe something like that.
Okay, so it's comparable to Canada.
Yeah.
So it's interesting, because here sort of the feeling is that if you're at home and you're getting $2,000 a month and you were making minimum wage, you're making pretty much the same or close to what you might have been making, at a minimum wage job, without all of the headache of trying to get there and having, obviously anybody who was making that little would have been supplementing it with another job or some other type of income or dual incomes and that kind of thing. But a lot of conversation here about universal basic income and keeping it at that line, people having that guaranteed $24,000 a year as a baseline to fall back on. But yeah, I mean, again, it does bring up those conversations of whether or not or how that is implemented. A universal basic income. For
is
people.
That per household or per person?
Per person. So there's some eligibility requirements in terms of you have to show that you couldn't work or your business was affected, etc. Much like EI requirements, but a little bit less restrictive. The idea was to be able to roll it out quickly, as much as and make it as universal or as possible. Obviously there's a lot of drawbacks. I mean, it's not tied to income or previous income or anything like that, which I think is a bit concerning. So yeah, I mean, I don't know. From here, I think that when people look at countries where you are, and in Scandinavian countries and European countries, like I think that people, we hear a lot of positives and then we hear the negatives as well. High tax rates being one of those. Obviously, people who are more conservative in nature are concerned about high tax rates. But I think there's a new generation of these social democrats who believe that they're okay, like you're saying, paying a high tax rate if it means that you're taken care of and your fellow citizens are taken care of by your government. But we don't have that confidence in government here, Vince, right? I mean, over and over, government has shown us that whenever we are paying more taxes or new taxes, that they still can't control the spending, and it still isn't properly handled in terms of providing the basic needs for citizens, right? So I think people are very shy and reluctant. You know, the conversation of provincial sales tax in Alberta has been going on for decades, right? So that's one of the reasons, right, is that people aren't confident that, you know, if we allow government to tax us more, that the money will be spent in our favor.
Yeah. What is the GST and you know, what is it now?
So federally, GST is still the 5%, but there is no sales tax in Alberta. We're the lowest taxed province in Canada. So we don't have a harmonized sales tax or provincial sales tax like all the other provinces do. So that's it. We just pay the 5%.
Take a guess what we pay in Sweden.
25.
25.
Yeah. Yeah. You know, and that's a consumption tax.
Yeah. Yeah.
You know, and there's a lot of research and evidence and arguments in favor of that, right? Is that consumption tax is the way to go to keep the revenue where government's needed in order to provide the appropriate levels of public programming, right? Like for healthcare, education, even, you know, providing universal pharmacare and universal daycare and all of these kinds of things. I think, you know, I think people would be open to that again, but people are wary of the fact is if that is what it's going to be spent on, or if continually we'll be handed deficits because government has chose to spend it on things that, you know, we weren't told that it was going to be spent on, which has happened, which wouldn't be the first time that it's happened, right?
Yeah. Interesting.
No.
But I, you know, in retrospect, I have to say, I mean, definitely raising kids here was a good choice. We have good schools, good school systems. It's a little bit, unfortunately, the kids here are a little bit. I mean, it can't be easy to be a 16, 17, 18-year-old boy or girl, for that matter, with the social pressures and Instagram and Snapchat and all that stuff. But I mean, there's a lot of pressures still here, but I mean, they've got good quality of teaching. They've got good quality of daycares. You know, they've got food up into through high school. You get your lunch as you go to a cafeteria. You've got a choice of, you know, meat, fish, salad. Everything is free for the students that go there. If for whatever reason they're not able, like now, right before this happened, they were given coupons to go to different restaurants in town as well to get their food because the cafeteria had been closed. So there's just that part there of not having to take sandwiches and soda to school with you. You know, going there and be able to eat vegetables and salad and meat and fish, eat good food. That's something that I've really appreciated with Sweden.
Yeah, you know, it's ridiculous. It's ridiculous that in a country like Canada, where we are actually quite highly taxed overall in comparison to other countries, it's ridiculous that our food banks, you know, are overburdened. You know, they're in Ontario, they're turning, you know, libraries into food banks. The food banks can't keep up with the demand. You know, and that was like within a couple of weeks, Vince, right? So is it, you know, well, you know, something is broken when after just a couple of weeks of economic hardship, people have to turn to food banks, right? So that to me like shows, you know, that we do live in sort of, we don't live in reality in Canada thinking that we have it so much better than the US or other countries, right? When that, you know, basically happened, you know, virtually overnight, where the demand on food banks, the demands on EIs went through the roof because, you know, it showed that most people had, you know, $700 worth of savings. You know what I mean? Like most people couldn't survive even missing 1 or 2 paychecks, right? You know, so it's ridiculous to think that we pay the kind of taxes that we do, and we don't have the social safety nets that we should have in return.
You compare Canada to the US, what would you say about that?
What do you mean?
In terms of social security, healthcare?
I mean, there's no argument. I mean, we're far, heads and shoulders above the U.S. and taking care of our citizens. But what I'm worried about, and I think a lot of people are worried about, is that degradation, of the systems as things move forward, because we allow American companies to, especially in Alberta, to operate here with basically impunity, right, in the oil sands, etc. And they don't operate any differently here than they do in the U.S. Our banks are some of the most profitable in the world. They've done so far nothing for citizens, right? Insurance companies have done nothing for citizens, right? All they've done is, make excuses of why this isn't business covered by business interruption, why it's not force majeure, act of God type of a situation. I mean, I don't understand, if this isn't an act of God, if this doesn't activate your act of God clause, I don't know what does. Do you know what I mean? If this isn't business interruption, what is? You know what I mean? Like, but they use their, small print to get out of these things. And you got a lot of bank CEOs, talking about how, we need to have basic income and these, kind of things, but they've done nothing, right? They've, what they've offered here is deferrals, Vince. You and I both know that if we want a deferral on our loan, we can get that anytime, right? Bank would prefer giving you a deferral for a month or 2 or 3 rather than you defaulting on your loan. And by the way, they make more interest and more money off of you when you defer, because it just gets added on, to your term, and you end up paying more interest in the long term. So, that's how ridiculous it is, Vince, right? So, I always hesitate to always, look down on US and what's happening there, because I see it slowly happening in Canada as well. Whereas more and more this idea of trickle down economics, right, giving bailouts to large companies, I already know, and I think most of us have, are prepared for the fact that there's going to be massive bailouts for, large corporations, when things get back to normal in terms of airlines and tourism and some of the industries that are hit largely by this. I'm sure even like banks and insurance companies will figure out a way to get bailouts as well. So by the end of the day, we were expecting that in the meantime we would be taken care of by these large corporations, right? I mean, if these large corporations that have made billions of dollars in profit off of us, especially like utility companies, it's like utility companies have done nothing for us. Like, there is no suspension of your water, gas, heat bills, right? You can defer. You know what I mean? I was talking to my commercial insurance company the other day, and they're like, "Oh yeah, you can defer, your business insurance for 2-3 months, but then we expect you to pay for all 3 deferrals in 1 month." Like, are you joking? If I'm at the point where I can't afford to pay my business insurance for 2-3 months, what makes you think that in July I'll be able to pay for all those 3 months at once? Like, it's ridiculous, man. But in the meantime, they're saving money like crazy, right? Insurance companies, people aren't driving, so you're telling me, they're saving money hand over fist, right? Yeah. They actually should be refunding that money. They should be refunding us premiums. What is the risk that I have right now at my business when it's shuttered, when it's closed? Nobody's working there. You should actually be giving me back money. You shouldn't be asking me to defer my insurance and pay it back, all 3 deferred payments, pay it back in 1 month. Are you joking? Like, and this is like how ridiculous our capitalist system is, and I think we have to be careful about always comparing ourselves to the US. There's always going to be countries that are worse off than us. We should actually look at countries that are dealing with these situations better and protecting their citizens better. I mean, there has been talks now about not providing bailouts to countries or to large corporations that are using offshore tax havens. I think that's a good step, and that's modeled after some of the stuff that's happening in Europe. I mean, Canada wasn't the first to have that conversation, right? But I'd like to see the conversation being is like, no one gets bailout who didn't help. You know what I mean? Like, what did you do? What did you do during the pandemic to ease the lives and the burdens on everyday citizens? Banks, insurance companies, even airlines. Okay, so this wage subsidy program that you guys have, we have something similar here, right? Where employers can get, I think it's 40% of the wage of the employee, right? So the airlines hired back people, right? But freely admitting that the people that wouldn't have anything to do, because what are you hiring them back to do, right? There's nobody's taking flights. right? So wouldn't it be innovative or interesting if you found different ways to deploy those people, right? And helping maybe the more vulnerable, helping nonprofits, helping frontline staff, essential workers. But there's none of that conversation, because the execution and the infrastructure and the retooling that would require would cost those industries more money, right? So it's ridiculous to think that these guys are going to be laying out for lining up for billion-dollar bailouts in a few months, when, they were provided assistance, but they didn't do anything to help citizens or to pay back, right? It's ridiculous that we keep being told that we should have 2 to 3 months of safety of savings, household savings to get us through things like this. Like, why don't you have 2-3 months? Like, why do you only have $700 or whatever the case is? It's ridiculous. But you're telling me these corporations that are making multi-billion dollars in profits quarter after quarter for decades, they can't get through a few months. They can't now empty their coffers and help citizens and then get your bailouts later. But that's the kind of environment, the capitalistic environment that, you talked about, aggressive aggressive sales in Canada, right? But that's what the other side of that sword is, right? Is that we live in this environment where, this capitalistic environment where it's just like everybody's out for themselves, and, profit for shareholders comes first, and then later on taking care of citizens. This was the one time that large corporations had a chance to show that they actually cared about everyday people, and actually, walk the talk of being woke and wanting to contribute to the social fabric of a country, and they failed miserably. There's very little evidence that any large corporation that has been highly profitable over the decades off the back of either public utilities and public resources, or just on the back of consumer fees like banks are, of actually contributing back and helping.
Dismal.
Yeah, it is. It's not. I don't want to seem overly negative, I think, but it is, concerning, and I think these things are coming to light. My fear is that, after the restrictions are lifted and we all get back to trying to return back to our lives and salvage our businesses and our careers, and get back to some sort of normal routine, that we'll forget all of this, right? And that nothing really will change. But hopefully, the longer it goes on, it would be nice to see a raised consciousness about, and keeping track of, those elected officials and those corporations that actually, went out of their way to give back and help during this time, during these difficult times, and those who didn't, and making sure that we push for some changes.
Yeah. Interesting to get caught up on this a little bit, because I have to admit I haven't really read much about Canada's.
No, you're out there living in a social utopia, man. You're out there living in nirvana with your 4 weeks of vacation at a time, probably 6 weeks.
5. It's five from the first year. 5 weeks, 4 together.
No, that's the life, man, I've always marveled at the fact that, once you start working, you are lucky once you start working if you get more than 2 weeks off at a time for the rest of your working life until you retire. Isn't that ridiculous? To live in a place that has the resources that Canada or the US has, the amount of resources and infrastructure that we have, the amount of taxes we pay, that for 40 years or more, we will never be able to take 2 weeks of vacation. Most of us will never be able to take more than 2 weeks of vacation at a time.